You can come in.
Hello, my name's Bianca. I'm going to be your student nurse. I'm here to perform a health assessment on you, okay?
Okay.
Okay, so first I would start off by washing my hands and donning my gloves. Can you go ahead and state your full name and date of birth for me, please?
Jacqueline Melkine, August 26, 1997.
Okay, so I would just verify that her wristband and her records show full name, date of birth, and MRN number, and they do match. Are you allergic to any foods?
No.
Any medications?
No.
Anything in the environment?
No.
How about any latex?
Mm-mm.
Tape?
Nope.
So I would just verify that her wristband and record both show no allergies, which they do. Okay, Miss Malcon, I'm going to go ahead and go over all of your vital signs with you. They were in normal range. Your blood pressure was 120/80. Your temperature was 97 degrees. Your heart rate was 60. Your respiratory rate was 17. And your oxygen saturation was 98%. Okay, so all of them were in normal range.
Mm-hmm.
Are you in any pain?
Yeah.
Okay, well, when did the pain start?
Like 3 days ago.
Okay, where's the pain located?
My left knee.
Your left knee. Okay.
Mm.
How long has the pain lasted?
It's like constant.
Okay. And how would you describe the pain?
It's like an achy feeling.
What makes the pain feel worse?
Like any movement.
What makes it feel better?
I've been icing it.
Okay. And what treatments have you tried to relieve the pain?
Just Tylenol.
Okay. And on a scale from 0 to 10, 0 being no pain to 10 being the worst pain possible, how would you rate your pain at this moment?
A 9.
Okay. So my patient has already stated her full name and date of birth. Miss Melcon, where are we at right now?
The hospital.
What month are we in?
June.
Okay. And where are we here right now?
Because my knee's hurting me.
Okay. So my patient is alert and oriented to person, place, and time. I don't see any kind of symptoms of distress on my patient, and her body is symmetrical on both sides. Okay, now I'm going to go ahead and see if my patient has an oxygen apparatus. She does not, but if she did, I would assess it in the following way. First, I would make sure that her oxygen apparatus is properly placed, that there's no skin breakage surrounding the area, that it's comfortable for my patient, no kinks in the tubing, that the flow is not obstructed, and that the flow rate matches what the provider had requested. Now I'm going to go see if my patient has an IV line. She does not, but if she did, I would assess it in the following way. First, I would make sure that it's properly placed, that there's no skin breakdown surrounding the area, no kinks in the tubing, that the flow is not obstructed, and that the flow rate matches what the provider had ordered. I would make sure to also palpate around the IV line, ask my patient if she has any kind of tenderness, and observe for any edema or erythema. Next, I'm going to go see if my patient has a urinary catheter. My patient does not, but if she did, I would assess it in the following way. First, I would make sure that it is properly placed, that it is secured to her leg, that there's no skin breakage surrounding the area, that there's no kinks in the tubing, and that the flow is regular. I would also make sure that the collection bag is in a proper area, like the edge of the bed frame. I would make sure to take note of any urine amount, consistency, or the appearance of the urine as well. Now I'm going to go ahead and check my patient's hair. Okay. I don't see any kind of breakage. Her hair is even. I don't see any lesions, any rashes. Okay, thank you. My patient's skin color does match what is expected for her ethnicity. I do see that her skin is symmetrical on both sides. Now I'm going to go ahead and observe for any kind of lesions. I don't see any lesions, any bruising breakdown, any rashes, or any wounds. Miss Malcon, are there any wounds that I don't see? Okay. Well, if there were any wounds present, I would make sure to take note of the drainage, the drain, the appearance, and the dressing. Okay, now I'm going to go ahead and feel for your skin temperature with the back of my hands, okay? Thank you. So her skin is warm and even bilaterally. All right, now I'm going to go ahead and pinch the top of your hand. Her skin is elastic. She has good elasticity, and I don't see any kind of tinting present. Now I'm going to go ahead and check her capillary refill on each thumb and each toe. Okay, so her capillary refill is normal. It's less than 3 seconds on all 4 extremities, and I don't see any kind of edema present. Okay, so now I'm gonna go ahead and look at your ears with my flashlight. Okay. Okay, thank you. So her ears are symmetrical. I don't see any kind of lesions, any rashes. I don't see any drainage or skin breakdown. I'm gonna go ahead and palpate your ears now. Let me know if you feel any kind of tenderness. Okay, so my patient doesn't state she has any kind of tenderness, and I don't feel any nodules present. Now I'm gonna go ahead and check for your eyes, okay? If you can just put your hand up like this, look straight at my forehead, and I'm gonna shine a light twice in each eye, okay? Okay. The other side. Okay, thank you. Alrighty, and go ahead and follow my finger. Okay, thank you. So my patient's pupils are equal, round, and reactive to light and accommodation. Can you go ahead and tilt your head back and lower your eyes like this? So my patient's conjunctiva is pink and moist, and her sclera is white. Go ahead and keep your head tilted a little back. I'm gonna look at your nose now. Thank you. So her septum is midline. I don't see any kind of rashes, any lesions, any skin breakdown, or any drainage. If you can just open your mouth out wide and say ah.
Ah.
Thank you. So her oral mucosa is pink and moist. I don't see any kind of sores or any lesions. I don't see any skin breakdown, and her tongue is smooth and intact. Okay. Now I'm gonna ask you to make a big smile for me, please. Thank you. So her facial features are symmetrical. Okay, so in a clinical setting, I would make sure to observe my patient's breathing discreetly. My patient doesn't seem to have any labored breathing. I don't see her using any accessory muscles, and she doesn't appear to be in any kind of respiratory distress. Okay, so Miss Malcon, I'm gonna go ahead and listen to your lungs, okay? Every time you feel my stethoscope on your skin, just give me a nice deep breath. If you start feeling any kind of dizziness, just let me know. We can take a break, okay? In a clinical setting, I would make sure to listen directly on skin. I'm gonna listen in a Greek key pattern and go from apex to base. If you can just sit at the edge of the bed for me so the camera can see your back. Thank you. And I'm gonna listen with my diaphragm.
Okay.
Okay, thank you. You can go ahead and lay back for me, thank you. So my patient's lung fields are all clear. I don't observe any kind of rhonchi, any crackles, or any wheezing. Her chest expansion was equal bilaterally. If my patient did need to use an incentive spirometer, I would make sure to teach her how to use it and ask her to demonstrate it back to me. Okay, so now I'm gonna go ahead and palpate her carotid arteries. Okay, thank you. I don't feel any thrills present. Now I'm gonna go ahead and palpate her radial arteries. If I can just see your wrist, thank you. Her radial pulses are 2+ bilaterally, and her pedal pulses are 2+ bilaterally as well. Okay, now in a clinical setting, I would make sure to palpate her PMI. I would do this by finding the left midclavicular line and also the 5th intercostal space. I would observe and notate any kind of lifts or heaves present. Now I'm going to go ahead and auscultate her carotid arteries with my bell. Okay, I don't hear any breweries present. Now I'm going to go ahead and listen to the fields of her heart. First, I'm going to start off in the aortic area, which is in the left sternal border. The right sternal border, second intercostal space. Then the pulmonic area, which is in the left sternal border, the second intercostal space. Then the Erb's point, third intercostal space, the left sternal border, and then the tricuspid area, which is in the fourth intercostal space, the left sternal border, and then the mitral area, which is in the fifth intercostal space, left midclavicular line. Okay, and then I'm going to make sure to do this with my bell and diaphragm. If you can just face the camera, please. Okay, thank you. You can go ahead and lay back for me. Thank you. So I would also, in a clinical setting, make sure to listen to the mitral area and the PMI, which are both located in the left midclavicular line, fifth intercostal space. Her heart did sound regular in rhythm and rate in all sections, and I didn't hear any kind of extra sounds present, and S1 and S2 were present. Okay. Are you having any tenderness, any tingling, any swelling, or any numbness in any of your extremities?
No.
No? Okay. So I'm going to go ahead and take your hands. Go ahead and push me. Okay, don't let me push you. Don't let me push you. Alrighty. And then go ahead and step on the gas. Okay, thank you. And then go ahead and pull back. Thank you. So her hands were equal in strength bilaterally, her feet were equal in strength bilaterally. She has an overall muscle strength of 5 out of 5, and she has full range of motion against gravity and full resistance. Okay, now I'm going to go ahead and ask some questions about her GI system. Miss Malcon, are you having any vomiting?
No.
Nausea?
No.
Any diarrhea?
Mm-mm.
Okay. And when was the last bowel movement?
An hour ago.
Alrighty. And do you have any dietary restrictions? Okay. And was your bowel movement regular? Was it abnormal or normal?
Normal.
Okay. Alrighty. So I'm going to go ahead and ask you to lay flat on your back, please. You can go ahead and just come down. Okay, I'm going to lift your shirt up so I can inspect your abdomen. So her abdomen is flat. I don't see any pulsations, and it is symmetrical. Okay, I'm going to go ahead and listen to her abdomen now. I'm going to listen to the 4 quadrants. I'm going to listen for 15 seconds in each quadrant, and I'm going to note any kind of bowel sounds. I'm going to do this with my diaphragm. Okay, so my patient did have bowel sounds in all of her quadrants. If she did not, I would make sure to listen for 5 minutes in each quadrant. Now I'm going to go ahead and listen to her aorta with my bell. Okay, so I didn't hear any breweries present. Now I'm going to go ahead and palpate her abdomen. Miss Malcon, I'm going to press a little firmly on your abdomen 4 times, okay? Let me know if you have any kind of tenderness.
Okay.
Okay, now I'm going to press a little bit harder, but with 2 hands, okay?
Yeah.
Okay, so my patient didn't state she had any tenderness. I don't feel any masses present. She was not guarding and her abdomen was soft. You can go ahead and sit back up for me, thank you. Okay. Have you found yourself having to urinate more frequently?
No.
Okay, how many times would you say daily that you do go urinate?
A few times a day.
Okay.
A good amount.
Okay. And when was the last time you did urinate?
An hour ago.
Was it normal or abnormal for you?
Normal.
Okay. So I would just make sure to measure or monitor my patient's intake and also output. Okay, so now I'm going to go ahead and show my patient where her call light is. It's within reach. Do you know how to use a call light?
Can you show me?
Sure. I'm going to go ahead and demonstrate it for her. You're going to press this, and then if you can just do it for me. Thank you. So I'll have that close to her. Her bed is down. Her side rails are up. And is there anything else I can do for you? Okay.
Nope.
Well, thank you, Miss Malcon. I would go ahead and wash my hands before I leave her room. Thank you. Have a great day.
You too.